All right, guys. Well, we're going to talk about some suicide prevention today. I'm Justin from Blomquist Hell, your EAP, and so we recording this video for you guys so that you guys can get some helpful insight and some thoughts about how to prevent suicide and be supportive towards people that are struggling. And if you're struggling, find out some help of some things that can be beneficial for you guys. So we're going to do that today, and hopefully this is really good. And if you ever have any questions, feel free to email me or call Blomquist Hell, but my email is just justin@blomquisthell.com if you have any questions about suicide prevention or anything else. So just to begin with, I want to talk about the benefit a little bit of Blomquist Hell, and a lot of you might know some about this, but I want to tell you a tiny bit. So we're here to help with any challenge, any life challenge that you could have. So if you're dealing with stress, or you're dealing with thoughts of suicide or anxiety or depression, or you have some family issues, whatever it is, we want to be there to help with that. And so feel free to give us a call and come in from an appointment whenever you need it. So with that, the counseling is free and it's 100% confidential. So Harmons or anybody else will never know that you came in or anything that you said. And then with that, right now we're doing a lot of phone or video counseling. In some areas, in Ogden and Orem, we're meeting with people by phone and video, but also on site if that's what somebody would like to do at this time. Simple process to get an appointment. All you have to do is call the number, 801-262-9619, and that's the Blomquist Hell number, and that can get you to us at any time. And with that, just call in and say, hey, I work for Harmons and I'd like to come in for an appointment. And they'll get you set up in your area with an appointment with a therapist. So simple way to do that. That number that I just gave you, if you call day or night, that is also our crisis line number. So if you call during normal hours, you'll probably be able to talk to a therapist right away that's actually in the office. If you call later, there's always a therapist that's on call that could talk to you. So just be aware of that we're there to help as much as possible. The hours are usually 9 a.m. to 9 p.m. There's some therapists that are getting there as early as 8 o'clock now, but most days that's when we're there. We're also there on Fridays and even Saturdays into the afternoon from about 8 to 3. So another thing that we've been doing a lot of, and you might have seen some of these, is YouTube. We're using that as a way to get a lot of these videos out. So we've recorded a lot of presentations. We've presented online to a lot of different people. And so we've recorded all of those. So if you get on YouTube and just search Blomquist Hell, then you will see 70 or 80 different presentations and growing as we keep doing those on tons and tons of different topics, from stress to depression, to parenting, to money. All different types of different types of presentations are on there. And like I said, we're making more. So, okay, let's talk about suicide a little bit and talk about understanding, what's going on with that. So the good news that I want you to think about as we're doing this today is that most people that think about suicide do not go on to die by suicide, which to me is really good news. There's some very key important factors in that, and some of that is social support that you can give. This is one of the reasons why we're talking about this topic today, is because social support is something that all of us can be a part of. And then some effective treatment can be really key, and that's more on a therapist, and that's more on maybe medication or whatever it is, whatever the person needs. But at that point, your support's really important, and then some treatment that can be really beneficial. So access to support is going to be something that's going to prevent suicide a great amount. So some things with this is there's some hope in this situation. So most people, as we talked about, that think about suicide, they don't actually want to die. What they want to do is escape some unbearable pain, and they want to solve a problem that they've been struggling with. And sometimes they think that there is no real way to solve this problem, and so that's why they think about suicide. A lot of times these people are feeling overwhelmed, they're hopeless, they kind of feel like a burden, you'll hear from time to time. So that's something that can happen. Um, but fortunately, a lot of times people show some warning signs, and we as their supports and their friends and therapists and stuff can kind of step in to help. So there's a lot of hope that even with people that are struggling, that we can really be there to support them and keep them from following through, or actually, dying by suicide. So some statistics for you guys to kind of think about. Utah, as you can see here on this map, is sixth in the nation for most suicides. You can see that kind of box looking thing of those states right there. A lot of states around us are the states that a lot of people are dying by suicide. And one thing I want you to think about a little bit is, why do you think this is the case? Why do you think there's a lot more people dying by suicide in this particular area? And it's an interesting question that I don't think there's a perfect answer to, as you guys are thinking about that. Some thoughts that some people have, a big one, people will say, well, it's the religious aspect of Utah, is what kind of pushes that. Some people will say, well, maybe it's even the elevation, because a lot of these states have more elevation in them, which is an interesting idea. Some of them is, well, people are more spread out. There's more isolation. There's more smaller cities and people around, rather than California or New York, where everything's, a lot more clumped together. Some people say access to firearms, guns and everything is a big one, and so those are some ideas of some things. In everything that we know, there's probably all of those things combined to kind of highlight, the large number, rather than, just the religious factor. Usually, there's some states in there that aren't very religious, and so something to kind of think about with that. Now there's some statistics for you. So these are Utah deaths over the last 10 years. As you can see, by firearms. So, most of the firearm deaths are suicide. There is some other ones that are happening. And then if you look to the right on that circle graph, you can kind of see that most suicides, 50% of them, are by firearms. So firearms is a big deal when we're thinking about suicide. So we'll talk a little bit more about that as we go. So Utah, as you can see, is, throughout all the years, is considerably above the national rate of suicide, hence where that number comes in. But that's something that we really, really want to address and reduce. And that's something the state of Utah is really, really working on. That's a number that is known, and we're trying to do something about. And Blomquist Hill is very much a part of that. So just some Utah statistics for you. So on average, one person dies by suicide every 13 hours in Utah. That's a ton. That's almost 2 a day. So suicide is the 7th leading cause of death in Utah. And then a couple more for you. So it's the first leading cause in kids or teenagers or young adults from 15 to 24, and the second leading cause of 25 to 44. As you saw, Utah's 6th in the nation. So these are some statistics that we really, really want to reduce. Hence why we're doing this training today, this presentation, to try to reduce some of those things. So think this is the last slide for you about statistics. So suicide is the 10th leading cause of death in the US. In 2018, almost 47,000 people died by suicide. So interesting statistic here that 20 out of everybody that attempts suicide, out of 25 people, only one of them die by suicide. Men are more likely to die by suicide, as you can see, about 3.5% than women. And it's probably, easy for you guys to understand why they're more likely to use guns than women are. And we know that guns is more likely for their life to end by suicide. So on average in the United States, there's 129 suicides per day. As you can see, firearms is a big reason for that. And so the highest rate of suicide in the nation is middle-aged men, middle-aged white men. So, okay. So let's talk about our role as friends, as coworkers, as people that could be around somebody that's struggling. So, peers have this really powerful ability to help people to reduce some of that shame and isolation and anxiety that they could be having, even about suicidal thoughts. As you've probably felt, and there's been a lot of people, I don't think any of us have been around anybody that hasn't had suicidal thoughts nowadays. Whether it was really significant or not, I think that's kind of a part of our society. So as a peer, like I said, as a coworker, we can promote hope that life is still worth living, and there's been some good in your life, and that can be restored. So that's one thing that we're thinking about. As a peer, you can help them to navigate any health and mental health systems that are out there. That's sometimes that can be difficult. One of those could be Blomquist-Hill, of one of those systems of, hey, we have this great benefit that's free and confidential, and you can go in there and meet with a therapist. Another one is we help to, people to work through some of those thoughts and to manage it, and that sometimes those thoughts can be understandable, and we're going to talk about that a little bit going forward. And we can help people use some of the skills that they're learning, whether that's from each other, whether that's from counseling, whatever it is, we can help them follow through with those skills if it's something that somebody we really care about. And we can, identify when somebody needs help. So that's kind of our role as peers in this situation. So some of the limitations that we should kind of think about as a peer is if somebody does have a weapon or is, behaving pretty aggressively, then that's when we want you to be safe. And, if you're at work, that's talking to supervisors, that's talking to other people, and maybe that's calling the police if needed. We don't want to promise more than we can actually deliver. We don't want to promise that we're going to be with them and support them every single day, and we're going to text them and call them. We want to promise that we're going to be there to support them, but don't overpromise what you can do. And just something to kind of think about with that. So we don't want to, turn ourselves into the therapist and be like, well, this is, you're an extreme suicidal risk, and you need this medication and these types of things. You're there to be a support, and we don't want you to be the only support. Once this happens, it's good to get other people involved. Like we said, a therapist, a family, people that they care about. And we try to do that, as confidential as possible. We don't want to, share that with everybody at work, but maybe supervisors, maybe people that are really important to them, and you'd like to talk about it with them before you share it. But if that can't happen, then you want to be really careful, but you don't want to be the only person that knows about what's going on. That can be a lot to kind of weigh you down when that kind of happens. It's not your goal to process, really traumatic events with this person. We're going to talk about listening. We're going to talk about being a part of it. But you don't have to be doing different types of therapy and really processing all of these things. It's good to listen, but you don't have to be, like I said, the sole person doing this and working through that. So, as much as possible, it's okay to share some of your opinions. It's okay to share that, hey, my mom takes medication or whatever, and be supportive, but it's probably not your goal to be the doctor and say, hey, this is the medication that you need. This is what you should be doing, all of these different types of things. So kind of understanding suicide a little bit more. So just because this person's suicidal or has thoughts, it doesn't mean they want to die. That's one thing that we've kind of talked about a little bit, is they just want to escape, this problem to some extent. And we want you guys to think about it's your role, your support, the things that you can do is to help them to reconnect with reasons for living. There's a lot of people that think about suicide that are very uncertain if that's what they should be doing, if that's really a good idea. And so if we can help them reconnect to reasons for living, then most likely, they're not going to follow through with that. They're not going to die by suicide. And a lot of these people are going to be connected to other people or pets or a purpose. And we want to help them to reconnect with that at a time. So let's talk about some myths and some truths. So talking about suicide is a bad idea and can be interpreted as encouragement. And so is that a myth, or is that a true statement? So we know that to be a myth. So some people are scared about talking about suicide, and that kind of will make it more likely that they do it. The truth is, these couple things. Talking about it in a non-judgmental way can help remove the stigma, and people can actually be pretty relieved that somebody understands and somebody cares and somebody's open to talking about this really difficult subject with them. So it could be the first time that that's ever happened. So actually talking about it is a good thing, and it creates an opportunity for the person to get help. So being open and talking about it is an important thing. So how about this one? Only people with mental health disorders are suicidal. So some people think that that's a true statement. It's going to be a myth also. So like we've said, these people are in immense pain and they're just kind of seeking a way out. So not all of them are going to be diagnosed with a mental health condition. And some of them could be suffering from a severe loss or undergoing a really stressful life event. The hard thing about life is we're all going to have a lot of stress in our lives. This year has had more stress than I think most of us thought was possible, with lots of different specific things going on, and those are just kind of global, nation things. Those aren't even, individual things with money and relationships and all of those things. I talk to people all the time about stress and how difficult it is. Stress is probably the thing that we talk about most. And like I said, on that YouTube channel, there's a lot of presentations on stress. I know I'm doing another one next week over YouTube if you're interested in that. So another one for you. So a myth, most suicides happen suddenly without warning. So a lot of people think, well, they just think about it and then it happens, and so the truth is that doesn't happen a lot. And I'm going to show you a statistic about that in the future. But while sometimes that does happen, most suicides are preceded by talking about it or behaviors, different warning signs that we can pick up on and help the person with. And so sometimes people have thought about it for a long time, and then they just, in that moment, they just kind of do it. So they're usually going to show some signs that we can do stuff about. So we want to take those signs seriously, even if that it's just kind of a cry for help. Let's help them when they're having that cry for help. So one last myth for you. So someone who is suicidal is determined to die. That's one thing we've talked about a little bit, is that's not true. They're not determined to die. They just want to escape from this difficult situation. And remember, our role, what we want to help with, is to try to reconnect them to reasons for living. So let's talk about this kind of the circle of suicide prevention or protection. So most likely, if these things are in their lives, if they're doing a pretty good job at these things, then they're going to be less likely to think about suicide, and for sure, they're not going to die by suicide. So if they have pretty good problem-solving skills and emotional regulation, this is something that we probably need to talk about more in schools, and we need to teach people this a lot more often. If that's something that you feel like you're struggling with, Blom-Quistel is a perfect place for you to come in and just talk about those things. Whether you're struggling with something significant or not, it's just, hey, I want to work on some problem-solving skills. I want to work on how to regulate my emotions a little bit more. Perfect thing to come in and talk about. So people that have a sense of purpose in life, they're trying to achieve something. They're trying, maybe it's I'm trying to be a good parent, or I'm trying to move up the ladder at my job, or I want to do this thing in my life. This is real important to me. So any purpose is really good. This social connectedness, and this is to family and to friends, and to just have some people that they can rely on. If they have these three things, then it's a lot less likely that they're going to be thinking about suicide. Education and employment, that's a big thing to keep people from thinking about it. Access to means, like we talked about, having a gun available or medication or other things are things that we want to reduce. And then quality health care. So those things, that's going to make people less likely to think about it. So we want to try to encourage those and help people to have those as much as possible. Some warning signs for you guys, and these are things that you could hear them say, or just things that you could see them doing. I'll just read a couple of them. So, my family would be better off without me. I just can't take it anymore. I wish I could go to sleep and never wake up. So those are things that if you hear them say, then it's triggers to ask some questions. It's a thing, it's showing you that, hey, maybe I should, see if they're doing okay. Are they just making a joke, or are they really actually struggling? Some behaviors, to think about is, saying goodbye, or tying up loose ends. Could be giving away pets, things that are real important to them. Sleeping, way too little or way too much. And a lot of times these activities are going to be things that are different than what they have been doing. So an interesting one, sudden unexplained calm or an uplifted mood. We want people to feel good and calm, but just talking about it with them, just asking questions and seeing if they're okay. That's what we're kind of looking for with some of these things. So let's talk about some more warning signs for you guys. I'll put some of these up. So, talk about wanting to die, feeling sad and depressed, feeling like a burden, is one that I'll hear from time to time. Isolating themselves is something to kind of look at. If they're no longer taking care of themselves, whether it's, they used to do their hair and their makeup all the time and look nice. Now they don't do those things anymore. That's something, like I said, that doesn't mean that they're suicidal, but it's a warning sign. It's something to think about. Feeling hopeless, changing in those eating patterns and sleeping and work patterns. Here's some more risk factors for you guys. As you can see, there's lots of different stuff that kind of comes up with that. Mental health disorders is a part of it. Remember, as we talked about, doesn't mean that they have to have that to be suicidal. Substance abuse, that's a difficult one. And a lot of times people that are, dying by suicide have substances in them, whether that's alcohol or drugs. Couple more previous suicide attempts is one that's a risk factor. Loss of relationships or jobs, things like that. Lack of social support. Just a lot of different things. Exposures to others who have died by suicide. Sometimes when there's ones that happen around, then people feel like it's something more that they could look into. It's a solution. Whereas, like I said, we just want to help them to reconnect to the good things in life, reconnect to the important things. So we talked about, asking about suicide and everything. And so these are some of the things that we want you to kind of do if you hear some of that. So ask directly, in a manner that shows that this could be, it's understandable. You don't want them to follow through with it or, to die by suicide, but this is a really difficult situation. I could see where you would have some of those thoughts. So, this is kind of, some ideas for you. So sometimes people, in this situation feel like they don't want to live anymore, or sometimes they think about killing themselves. Have you been having any of these thoughts? If you're seeing a lot of those signs, then this is a fair question to ask. You said you're feeling like you can't handle it anymore. When you say that, do you mean you're thinking about suicide? Remember, this is kind of blunt. We're coming out and saying it. And that is to help them to open up and to kind of talk about it. Like we talked earlier, this might be the first time and maybe even the only time that somebody has asked them about suicide. And they could be storing those feelings inside. And so somebody actually asking can be really beneficial and really helpful. So what to do when they say yes? So for one, thank them for being honest. And, this can be really hard to talk about, show some empathy. I'm glad you told me. I think I might be able to help. It sounds like you're in a lot of pain. I'm sorry you're going through this. So it's reflecting, it's active listening, it's being empathetic. That's what you're thinking about with these types of things. So listening can be really, really powerful. And so, as it takes, it helps a person feel cared for, and you gain a lot of insight into their thoughts. And it'll give you kind of clues about, maybe some social supports that they have. You can ask about, well, who are some people you can rely on? Who can you talk to? What's some coping skills that you might have? And you can talk about, have you had any past suicide attempts? Are you planning on doing it? So some things to think about with that. One thing, we want you to be comfortable with talking about it. But if you're not, it's okay to get a manager and say, hey, this is happening and I would really like some support. They're going to be trained in these types of things. It's okay to call us at Blomquist Health and say, hey, I ran into somebody that's really struggling. What can I do? So those are things to really think about with that. We don't want you to be the sole person that knows. To me, it would be really beneficial if you can get the person that is suicidal to have some buy-in. It's like, is it okay if we talk to our manager? Maybe that we can do it together. Is it okay if we call a significant other or whatever and talk to them a little bit? We want to get somebody else involved, and we don't want to get everybody involved, but we want to get somebody involved to kind of help. So here's some open-ended questions for you guys that you could ask. So will you tell me the story of, what got you to this point? Tell me about the day you felt most suicidal. What was happening? How did you feel? What did you do to cope with it? Obviously you're still here. What's been helping? Give them some time to talk without jumping in with advice or problem solving. We all want them to not feel that way, and we want to say, hey, if you just do this, or we could solve the problem by doing that. A lot of times it's going to be best just to listen and be empathetic rather than try to solve the problem at this point. It's going to matter more if they know that you care. You really want to listen to understand rather than listen to solve. If you're listening to solve, then they're not going to think that you actually really care about them. As the listener, allow yourself to take some time to breathe and to stay present with the person, And so if for some reason you need to leave or something's going on, try to get somebody else involved. Let them know, hey, I really care about you and I care about what you're saying. I have this, maybe it's I have to get back to work or I have to help this customer or whatever it is. What do you think about us telling this person and maybe that they can be with you while I'm, busy doing this other thing? So as much as possible, we want you to be present with them. There's going to be, maybe I can't be right now, and let's get somebody else involved. So some more, asking, listening type of things, like we said, ask directly about suicide, listen with concern and empathy, get some help. You don't have to be this on your own. Kind of create a safe place. If that means, taking away, a firearm or pills or whatever else it is, try to create a safe place. Talk about it with them. What would help for this place to feel safe? Try to be really supportive and get other people supportive. Be encouraging. We've kind of talked about that along. We want you to try to stay calm. why this is happening? Like I said, if this can be a really difficult thing, and so being as calm as you can is going to be something that's really beneficial. Recognize that you're going to have some emotions about this. Maybe you have close family members or other people that could have been in this spot before. It's okay to not have all the answers at this point. Like I said, that's why we're getting other people involved. You probably don't have all the answers. It's just beneficial to be there and to listen and to, be empathetic. It's good to know when to step aside and allow a manager, allow a therapist to kind of get involved, maybe a police officer if needed to kind of help out with this. You don't need to, like I said, you don't need to be the therapist. You don't need to label or diagnose anything. The confidentiality one's an interesting one. We want to try to be confidential with this, but we also want to get a few trusted people involved because we don't want you to be the sole person supporting them. So you try to be, you don't want to go around telling everyone. You don't want to do that. But you want to, for one, try to get the person that's struggling's buy-in, and then you also want to introduce some other people into this situation so that, for one, they have other supports, and so that you're not so weighed down by the difficulty of this situation. So getting management to step in can be really beneficial with that. So we talked about guns a little bit, just something to think about with this. So putting some time and distance in between a person and a very, serious way to end their life by suicide, which is a gun, and there's some other ones, but a gun's a big one. Some people think, well, won't they just substitute another method if we take away their gun or whatever it is? They might, but nearly anything else is a lot less likely to actually kill the person. So it might delay their attempt. And either way, the odds of survival go up by a ton. And I'm going to show you some statistics that kind of back that. But these are some of the reasons why the odds go up. So suicidal crises are often brief. That moment of making the decision is often, kind of happens like that at times. Even though they've been thinking about it for a long period of time and haven't done it, sometimes it's just that moment, and having a gun there can be a serious issue. Um, the deadliness of the attempt is one of the reasons why the mean matters. And then, 90% of those who attempt suicide and survive, they don't go on to kill themselves. And those are people that were pretty certain that they were 100% certain they were going to do it because they tried. 90% of them that live never kill themselves. So interesting thing for you. So people people admitted to a hospital after an attempt were asked how long they'd been thinking about suicide before the attempt. So as you can see, 48% of people, 10 minutes or less, they had been thinking about it. So they most likely had been struggling for a while, but that moment is just like, okay, that's something that I'm really thinking about. And so if we can keep a gun from them for 10 minutes, then most likely they're not going to do it. There's obviously, you can see some percentage that have been thinking about it for a long time, for days or months or whatever it is. They're going to show a lot of signs. And even these people that, like I said, that decide to do it within 10 minutes, they've thought about it for a while. And the hope is that we've seen some signs and we have some ability to try to connect them to the good things in life and the things that they are connected with. And we've listened and been empathetic, like the things we talked about today. So kind of maybe a last slide for you. So if you're helping yourself, so if you're feeling like you might hurt yourself, tell a trusted friend or a family member that can help. Tell somebody that you trust and feel comfortable with. Reach out to someone. There's the suicide prevention hotline listed there. There's texting for help. There's lots of different ways. Call us at Blomquist Health. Reach out in some way. If you're helping someone else, as much as possible, be there for them, talk to them, listen, be brave. There's, doing this is kind of a heroic thing, but you could really save somebody's life. So as you can see, that's why we talk about it. That's why it's important, why it's in our society nowadays. And so this is a training that's going on to everyone. And we want to help you guys to be as ready for it as possible. Because sadly, it's not if, it's more of when, you're going to run into somebody that's really struggling. This is a ton of resources for you. Of different things that can be really, really helpful. Obviously, the Suicide Prevention Lifeline is there and a huge one to use. The Safe Utah app, a lot of people are using apps. You can talk to people on that and have some really beneficial things. So just a lot of different, resources here. If somebody's really, really struggling, the emergency room is a good place to go. If they won't, talk to somebody on the suicide prevention lifeline, but just a lot of different things to talk to, along with, like I said, Blomquist Health is there, and I'll give you the number one more time. So it's 801-262-9619. If you're supporting somebody that's suicidal, or you're suicidal yourself, that's some of our role to help you with that. So I hope that was beneficial. Like I said, if you have any questions or comments or anything about that, you're welcome to talk to, for sure, your managers and everybody, but you're welcome to talk to me too. You can email me or call me. I'm there to help as much as possible. So thanks for listening to this, and take care of yourselves, and we'll talk to you later. Bye-bye.